first question, can dystonia of the tongue or face lead to a deterioration of the swallow and cause problems with secretions or increased rates of aspiration? Or is this more likely to be related to seizures?
The movements of the tongue, that's a bit difficult. I think it seems to be part of, I mean, it's been described in Rett Syndrome specifically, I think, over time. So people did video fluoroscopy, for example. I'm sure that was like years ago. I can remember feels like it was about 20 years ago, where they did video fluoroscopy serially in individuals with Rett syndrome, showing some deterioration occurring in the control of those tongue movements, the complexity of tongue movements. I mean, you could argue, you know, the movements around the tongue are probably the most complex. You know, all of the movements around the jaw and lips and tongue are the most complicated movements. There's, you know, it's probably got the highest concentration of muscles actually around the face, and the coordination of tongue movements is extremely complex as well. So it feels like it's more an apraxia almost. So apraxia, I think I mentioned before, is this kind of difficulty with coordination. Usually people use it to mean use of tools. So it's not quite the use of a tool, but or learned skills. So a learned skill with tongue would be whistling, for example. You know, you sometimes learn how to whistle by learning how to move your tongue movements. I can't whistle. I've never learned it, you know, so, you know, I can't construct my tongue muscles into the right shape to get a loud whistle, whereas other people can. So in Rett syndrome, I think the tongue movements are a type of, probably the closest thing is like an apraxia, a bit like the problems with walking, you know, with that stiff-legged walking. And you can get a deterioration in that, those tongue movements. So that's why you can get problems with swallowing and drooling developing over time. Often, you know, so you'll find in infants, for example, usual infants, they have a back and forth kind of suck, but they don't necessarily know they don't usually know how to move their tongue side to side. And then they learn how to do that as they get older. So there's a kind of maturation process that usually happens with learning how to control your tongue for even something that seems simple, such as swallowing. Now, you can get dystonia in the tongue as well. So, you know, you can certainly see, you know, that I mean, once again, we go back to the most classical condition, which is cerebral palsy. You can certainly see abnormal tongue movements with dystonia developing, and you can get dystonia in the vocal cords as well. So you can get kind of incoordination between breathing and swallowing as well. The reason I mention it is it doesn't necessarily respond to anti-dystonia medications, you know, those tongue movements. So sometimes, you know, if you try and treat it as dystonia and you put them on baclofen or clonidine, it doesn't necessarily reverse the issue, and sometimes it just makes you floppier in the, you know, the windpipe, basically, food pipe, without necessarily improving things. So slightly circular way of mentioning it, but I suppose it's, once again, it's trying to look at these problems and work out, is it actually dystonia, or dystonia that will respond to the treatments we've got, I suppose.